rates livestock agent in Hendry County. This is
Colleen Larson, and I'm the dairy agent in Okeechobee and surrounding counties.
And what we're going to talk to you about is calf 911. So you think about that title. What would that mean?
It's like if a calf gets hurt, you should doctor it like right away.
Right, an emergency situation. And our emergency situation is going to be feeding this orphan calf. Feeding orphan calves can be challenging. It can be fun. It can be rewarding. You got to be responsible, and it's a lot of commitment. You might know what the term commitment means.
It means trying to like make him make it like eat the milk or something.
Commitment. So commitment. Have you heard your mom say you got to be committed to something?
It means you have to put like all your heart into it and don't give up.
That is right. Is that what you were going to say? That is right, because that calf doesn't have a mom. So who's going to serve as the mom?
The one who's taking care.
That's right. So it's going to rely on a human being to help that. So when I say it's committed, you've got to feed that animal at least twice a day. So that would be all in one feeding twice a day, like with an hour apart? No, it means in the morning and at night. And you need to feed that calf at about the same time every day so you don't cause upset to that animal or stress. So I'm going to say that this animal is a newborn. It's newly born, does not have lost its mom. So that first milk that that calf needs is colostrum. Colostrum is that yellowy milky substance that is called the first milk. A calf is born with little to no antibodies. Antibodies are needed to what? Anybody have ever heard the term antibodies? They need that in order to fight off diseases. So they're getting that through the colostrum, because that colostrum is not passed through the placenta to the calf. They have to absorb it through that first milk. So with that being said, they have absorbed it within so many hours after birth. So once so many hours has passed, let's say 12 to 24, the absorption rate of the antibodies that that calf is getting is going to get smaller and smaller. If a calf doesn't have any antibodies at all, any colostrum, death may occur. Do we want that in our calves? No, we want to hopefully to have that calf to survive, because that might be one of your heifers that you're going to show at the county fair. If they didn't get the colostrum from their mom at birth, and you know they didn't get it, so you've got to feed it, you can buy this from a ranch supply, Tractor Supply, or let's say I have LaBelle Ranch Supply in my community. If you're from Okeechobee, there's W&W and some other places to buy this feed. Or if you're right here in Manatee County, in Hardy County, you've got the Hardy Ranch Supply. Go down there. But one of the things you need to make sure that you have all of your products that you need, because again, we're talking about calf 911, so it's an emergency situation. Can we wait to feed that calf later in the day? No. So it's a very important. Sometimes if a calf will not drink first, and if the calf is suckled from its mom, sometimes it's harder to introduce that bottle. If it has it, it may be easier. But this is a esophageal feeder, and you can stick down this to the left side, and it goes down in, so you could push it this far, and I'm not going to demonstrate this on this calf because it's already been done, and it kind of irritates the side. But you can get them to drink from here and feed that nutrition to them. Whenever we're bottle feeding, and I'm going to use this one per se, you're gonna restrain this animal, and and when I said patience, it's going to take a lot of patience. If you have a smaller area, you're better off. But you're going to take your leg over, and you're going to back this in the corner, and you're going to make sure you start with clean hands. Because why do I need clean hands?
Because if your hands are dirty, they might have germs on them, and you don't want them to get sick.
Right, because they are born with no immunity. This animal is born with all four stomachs. A four-stomach animal is called what? sure you've heard it over next door. A ruminant. So they, only one stomach is, when they're born, is functional, and that is the abomasum. So what they do is they have an esophageal groove that closes up, and whenever you, and then you stick your bottle in and it goes past that groove is closed, so it's not allowing any milk to your rumen, your reticulum, omasum. So if milk does get in that, you can cause upset because that part of the compartments are not functional and cannot digest the food. Only the abomasum at that point. It takes about, milk proteins are absorbed for less than 2 weeks of age, and then once they get plus 2 weeks of age, then they can utilize and digest non-milk proteins. What would be a non-milk protein in this area? Hay. What else? That's right. So when I try to get this animal to drink from a bottle, I may have to use my fingers to introduce that bottle in. I may have to rub its throat so that animal will start suckling. The more that animal suckles, the more enzyme that animal is going to produce. When feeding a calf, and I've already fed all the colostrum, I'm going to introduce, you're going to do the transition milk, and transition milk, you can add an egg to that bottle. I'm going to introduce a powdered form milk called milk replacer. Again, you can buy this from your ranch supplies. It is expensive. You want to measure this and go by the label's directions because one milk may be different than the other. It all depends. So make sure you read your label. And when I'm mixing this, am I going to just mix it however I want? No. Again, you're going to read the label. That animal is going to drink 8 to 10% of its body weight. So you're thinking about, so you're going to have to guesstimate that animal's weight. So let's say 100 pounds. What do you think that animal needs to be fed? A gallon a day. A gallon of water weighs what? Anybody learned that in elementary school? 8 pounds. So you're going to take that gallon of water you're going to have, and you're going to mix your milk. Only mix what you need for that morning feeding, and then come back and mix again. You do not want to save that over several hours because you don't want the quality of your milk to go down, and you don't want it to be set outside and sour. Because what does sour milk? And you don't want to cause any upset because this animal at a young age without its mom is already stressed out. Everybody agree?
Yes.
So we want the survival rate of this animal to increase as we go on day to day. When we are trying to wean from a bottle, we're going to base that on how much we're feeding that animal. We're going to introduce the feed probably plus 2 weeks of age because their digestion system, all compartments are not working until they get older. So the grain is going to help develop that rumen, their other compartments. So the more grain we give, we're going to introduce it slowly. When an animal's ready to wean, are we going to base that on being 3 months of age, 2 months of age? We're going to base that on how much this animal is eating. So before you can wean off the bottle, that animal needs to be eating on its own about 2 pounds of grain a day. So you're thinking, well, how much is 2 pounds? What's in this bucket? Are we going to use a scale to weigh it? Yeah, we need to have a scale available to weigh. And I'm going to turn it over to Colleen.
All right.
She's going to talk about the health of the critter.
All right, so sometimes, even if we do everything right when the calf is first born, and we know for sure that she either got colostrum from, or he got colostrum from his mom, or we feed a good quality colostrum and we keep it really clean, and we make sure that they're off to the right start, sometimes they can still get sick, right? So you guys get sick once in a while, right? Okay, so sometimes when you get sick, it's just because it just happens, because you can't help it. But sometimes when you get sick, maybe it's because you put these things in the wrong places. So where do your parents say don't put your fingers? In your nose, okay? So you can get bad stuff out of there and you can put bad stuff in there. Where else?
Your eyes.
In your eyes. Where else? In your mouth. So you guys hit on the really big ways that bacteria and pathogens is just a fancy word for bad bacteria, can get into their system. It could also be viruses and some other things, but those are the big things that cause diseases. On a newborn calf, there's one other place. Does anybody know the one other place that bacteria and pathogens can get into this newborn calf? Right there in the back, Lily.
The sheath of the navel.
Okay, the navel, okay? And they get something called joint ill whenever they have bacteria get in there. So if you know it's a newborn calf and you know that it hasn't been cleaned up by its mom, or even if the mom is really gentle and it will let you, there's a wasp around there. Just be careful, there's a wasp flying around you. So anyway, you want to make sure that you keep as many bacteria away from that calf as possible. So first off, we start with the right nutrition. Second off, we keep it clean and dry, so there's a lot less chance that they're going to introduce those things into their system. So if this was a muddy mess in here and they stuck their nose in it and it was full of manure from other animals and that kind of thing, then they could get sick from that. So we like to keep them on a clean, dry area. Does anybody know what else might carry bacteria on it?
Like maybe hay if you get it from bad place.
Well, and you want to check your quality, but it's something that flies around.
Flies.
There you go, okay? And do flies like to land on calves?
Yeah.
And sometimes they land around their eyes and their nose and their mouth and their tail, because sometimes they have some manure on their tail. So there's one or two flies hanging around here, and that's not a big deal. But if you go out and the calves have flies all over their eyes and their nose, there's bacteria on there, and that's going to get into their system, and they're going to have a hard time overcoming that illness. So most of the time you can solve most problems with keeping their environment clean and starting off with the right nutrition. But you don't always start off with the right nutrition, and then you have to address problems. So the two biggest problems that we have with keeping calves healthy, number one is called scours. Can anybody tell me the other name for scours?
Pneumonia.
The other name for scours. The other name for scours.
Scabs?
No.
Diarrhea.
Diarrhea. Does anybody like to have diarrhea?
No.
No. Calves don't like to have it either. So when calves get diarrhea, most of the time they say, nope, I'm not going to eat anymore because it doesn't feel good. So we have to make sure that we get that taken care of right away. It's not the diarrhea or the scours that ends up making the calf really sick and eventually dying if it's not resolved. It's the dehydration. So when you're dehydrated, those antibodies from the colostrum that Miss Sonja talked to you about, they can't travel through the system. They're kind of stuck. So when a calf or when you get dehydrated, that's what really causes the problem with their immune system. So the easiest way to look for signs of dehydration, first of all, you look at the calf's eyes. So if their eyes look really sunken in, almost like it's down inside their head, that's a visual way. So his eyes look pretty good. His ears are kind of perky. The next thing that we can do is we can pull on his skin, and you can see he wants to run away, but we're still going to do it. You pull on his skin and you see how quickly it goes back. Did you guys see it kind of bounce right back? So that means he's not dehydrated. If I pulled on his skin and it went real slowly back, that would mean that he was dehydrated. And then we have to do something to make sure that doesn't get any worse. So if he's willing to still drink, the first thing we would do is give him electrolytes. There's a lot of different types of electrolytes. You can put it in their water, or you can put it in a bottle with water, and you can feed them electrolytes, or you can use that esophageal feeder. But if you do not fix dehydration, it will lead to severe illness and eventually death if they continue. So the first step is just get the fluids back in them. But sometimes that's not enough, and we have to figure out what else is going on. So the next thing that we do is we try to make sure that their digestive system is healthy. And so there's a couple things that we can give them. So we can give them probiotics. Anybody ever have a probiotic when you're sick? A pill or anything like that? Okay, and it's not as strong as other medicines, so it's usually good for kind of a mild case. And this is another type. This is probiotics, enzymes, and vitamins. So that just gives them a little bit more of a boost. Whenever they have that diarrhea, their digestive system is not functioning right, and they're losing vitamins, minerals, and nutrients that their body needs to grow and thrive. So those are kind of the first steps. So we've got to have get the fluid back in them. Second, we make sure their gut is healthy. And then next, if that doesn't help, there could be more of a problem. So the next step would be to give them an antibiotic. So this is not a super strong antibiotic, and it's easy to administer, and it doesn't take a prescription. So this looks like a little bigger than a pill that you guys get, but not as big as a cow pill. So a cow pill is like 10 times the size of this. But we put this in here, and then the same way that you would give the milk with the esophageal feeder, you put it in the calf's mouth, and hopefully the calf chews, and then if they're chewing, it should go down the esophagus, and then you push this little thing, and hopefully if you push it out, it'll deposit it into their digestive system where it can kind of work on those bad bugs. If that doesn't work, then you go to a stronger antibiotic. Stronger antibiotics usually require a prescription, and they're very expensive. So that's kind of a last resort. So you want to start with the simple stuff first, and then move on to the more complicated things. Scours I'm talking about the most because almost every calf will deal with that. The next one, if we don't take care of other things and they're not getting healthier, sometimes, and we don't take care of our fly problem, then we can also end up with a respiratory disease. And if that respiratory disease gets bad enough and it gets down in their lungs, what will that turn into?
Like pneumonia.
Pneumonia. So those are the two most common diseases in calves are scours, number 1, and pneumonia, number 2. For pneumonia, a lot of times it does take an antibiotic to cure that, but we can prevent it if we keep them in a clean, dry environment, keep the flies away, and there'd be something really helpful if it was in this barn to help them not get a respiratory disease. What do you think that is?
If there was like closed-in walls to where they could,
The
where
opposite.
flies couldn't get in.
No, the opposite.
Open?
We want it open because we want a lot of airflow. So if there's a couple calves in there and they're breathing that smell of them urinating and the manure and that kind of thing, and that the air is not clean air, you know, you go in there and it's really smelly, that can also lead to pneumonia because that buildup of those things in the air can introduce some pathogens into their respiratory system. Okay, we have different, as you can see, there's different bottles up here. Make sure that you have all your equipment gathered before you start feeding your calf. Why should you do that?
Because if it doesn't take one bottle, you should go try the other bottle.
Okay, but we're talking about calf 911. We're in an emergency situation. Do we have time to run down the road if we don't have all of our equipment or the necessary milks that we need, such as milk replacer or colostrum? No. What if we have a bad bottle? So if we didn't test our equipment beforehand, what's the matter with this bottle? Anybody can see?
It has rips in it.
Has rips in it. What do you think that's caused by? That's caused by age. Or it may have been sitting in the sun and it's called dry rot. So this opening is too large. What may happen to a large opening when I'm trying to bottle feed that calf?
Let air spin.
It could do that, but it might cause that milk to go the wrong place, and maybe the rumen is not developed yet, and it's still in that groove is opening. That may cause bloat. Anybody know what side bloat is on? When you have to evaluate that to know if that calf is bloated? It's on the left side. So if the left is sticking out, you know that
is cause an upset in the rumen, and again, and it could cause bloat and soured stomach, and then lead to diarrhea. Here, Mrs. Colleen's going to talk about the other bottles.
So there's a lot of different types of bottles, and you don't have to have every single one of these, but there's advantages and disadvantages. So the one like Miss Sonja has over there, and there's another one of these are really hard to get on. So if your mom or dad has really strong hands and they can put this on for you, you can probably use this one. But if not, you might need one that's a little easier to get on. But the difference is these feel different. So sometimes calves don't like this if it doesn't feel like a normal nipple would on a cow. They make some that are kind of fancy that help prevent that, but there's a problem with these. So this one right here has 2 openings on it, and this one has a valve that keeps the milk from getting in there. And if you look real closely, you might even see what the problem is with this one. Does anybody see anything inside there? What does that look like? It's maybe some mold or some algae or something. So if you're solving one problem, but then you can't keep these clean, then you have another problem. So if you're going to use these type of feeding systems, you need to make sure that they're kept clean, because you don't want to introduce any bacteria. If you fix the problem of not giving them the milk too fast and you fix the bloat, but then you give them bacteria, then you're going to have a whole nother problem to deal with. So calves can be a challenge to raise, but once they start doing well, it's really good to see that your efforts have paid off, and most of the time you can get them back on their feet, and that's really fun to watch them. Does anybody have any questions before we go about calves and bottle feeding? Yes.
There's water and they eat the algae. Can it cause something like really severe?
There's a lot of different types of algae. Some algae have toxins in them, and some algae doesn't. There's even juice stores that sell algae that you can drink that's good and it has protein in it. So algae is not all made the same. There's a lot of different types of algae. If you do not have a water and I'm going to ask you to put your feet down so you don't get stuff in their water. If you do not have water that you're filling every day, if you have a water trough, you should be cleaning it at least every month, but checking it every day, because if you have a flock of birds that come in and they poop on that water trough, then you're going to have a problem. Birds carry coccidia, and if a calf gets coccidia, they will have bloody diarrhea, and it can be very severe, and it can even kill them. So cleanliness is the most important part of raising calves. Yes?
If the calves are still drinking milk, do they drink water too?
Absolutely. They have to have water on day 1 that they're born. And beef calves and dairy calves are a little bit different. Miss Sonja said you give grain after about 2 weeks, and they definitely can't do much digestion of it until then. With our dairy calves, we give it to them on day 3, because as soon as they can start digesting that, if they have a really healthy digestive system, the better, because it's a lot easier and a lot cheaper to feed grain and hay than it is milk, and it's a lot less work. Any other questions? What's the normal body temperature of a calf?
102.5.
Okay, so if you have a thermometer and you think your calf is sick and it has a fever, it's going to be up over 103.5. And that's a sign of some type of an infection. There's a lot of things, like we said, that you can treat yourself. If they have an infection and you go out there and it's a muddy mess and your water trough is full of nasty stuff, then you've got some work to do. It takes time every day to take care of them, and then also to evaluate the conditions that you have them in and make sure that you're doing the right thing. Anything else? So what is the first milk called? Everybody should know this one. Colostrum. That's the first milk. And how soon do we want to get it in them?
Like as soon as possible, but
As soon as possible. I saw a funny picture the other day, and it was at a dairy, and they were feeding colostrum to the calf while it was being born, because the question was, how soon is too soon? So there's never too soon. So the sooner they get colostrum, the better, but we really want to it in by 6 hours, but we have to have something in them by 12 hours. 24 hours is the absolute end of, you know, they're not going to get those antibodies that they need if we don't get it in them by 24 hours. Okay, and the two main diseases that affect calves,
It was diarrhea.
which is called what?
Colostrum.
No, diarrhea is also called
Scours.
scours. And then the other disease is called what? Pneumonia, and that comes from a respiratory infection. So those are the two main diseases of calf. Yes.
Isn't pink eye also?
Yes, and that's usually from flies. So if we keep the flies away, we can usually not have pink eye transmitted.
Watch out.
If you, is he gonna? Yeah, and you can see
And
he's,
look, is there any blood?
No.
it's just a little bit watery, but it's not solid water. So
It's
he's
starting to harden,
Yep.
as you can see.
He's kind of getting over his scours. All calves pretty much go through it at some point, so it's not a emergency if they have scours. Okay, do you guys have any other questions?
Well, that's mostly the basics of calf 911.
Can other cats live with other cats and they can get sick both together? And if one other cat gets sick, can they spread disease to all the cats?
They can. So there's some things that can be spread in the air, and then even if you're not with the other cat, you can get it. There's some things that are spread by nose-to-nose contact, and then there's some things that take other fluids to spread those. So calves, it would kind of make sense that it'd be better to keep them apart, but then that doesn't build their immune system as quickly. And also, calves are what kind of animals? Do they like to be by themselves?
No, ma'am, they like to be in a herd.
They're herd animals, so you actually have a lot of benefits. They might not look like they're playing with each other, but if you just had one of them in here, he'd be very stressed out. So it's calming him down, even though this one's just laying there. He's like, okay, there's another calf here, so I'm okay. If you take them and put them by themselves, they get stressed out sometimes. So you have the benefits of not passing diseases, but if you keep it clean, that's not as big of a problem. Yes, ma'am.
Like you said, that is like, say you had it like this, one cow was in here and the other cow was in there, would they still get stressed out even though they were right next to each other?
They kind of like to be able to touch each other. They do, and they can touch nose to nose here, but they do kind of like to be able to, touch each other and bump into each other. That's more of their natural interaction. And if you have them right next to each other, then their noses are going to touch anyway, so they can spread diseases back and forth that way.
Yeah, because my cow had pink eye in there and the other cow was really close to it.
Yeah, and the flies are the biggest reason that you end up with that. So you can spray the fly spray. There's a lot of different things you can do to help with flies. Number one, keep the manure out of there. That's the worst way to collect flies. Also, keep your feed cleaned up. Don't have feed scattered around. And if you've done all of that, then you can spray them with fly spray. You can do a pour-on that lasts a little bit longer when they're big enough for that and the label says it's okay. You can put a tag in their ear that keeps flies away from their face, and that can help. But really keeping things cleaned up is the best way to keep flies away.